Hi, everyone. Welcome to the Top 5 Things Fits Should Know About series. I'm Priya Patel, Chair of the AAAAI Fit Committee. This session is one of our series of the Top 5 Things Fits Should Know About Choosing and Joining Associations. Our guest presenter is Sheila Heitzig, Director of the Practice and Policy Division of the AAAAI. Sheila has served as the Director of Practice and Policy for the AAAAI since 2007. She holds a master's degree in nonprofit management from Regis University in Denver, Colorado, and a law degree from Marquette University in Milwaukee, Wisconsin, with a graduate certificate in dispute resolution. She has launched award-winning mentor groups in off-work hours. Welcome, Sheila, and thank you for leading this session. I will turn it over to you to get us started on the top 5 items you have for FITS about choosing and joining associations.
Great. Thank you, Dr. Patel. Very pleased to be with you tonight, and I'm happy to have been invited to participate in this Top 5 Things You Should Know series. I started out developing 5 things that you should know about associations and thought this goes contrary to what I think I know about Gen Z and millennials. And I hope that you'll apologize if I'm stereotyping here. So I threw my initial notes out the window and went to what I thought would be most interesting to you as opposed to for you. And the first thing I found was that doctors your age, people your age, people in, embarking on this career like you are, that you've already got so much time and effort and hard work invested in. What would be of interest to somebody at that stage of your career development? And what do I know based on what we can know about what we might know about you and your interests? The first thing I found was that you're bold. You'll go after what you want, clearly, or you wouldn't be where you are. And so that idea of you're willing to work really hard, you're willing to put yourself out there, fits so well with professional associations because it's literally a seat at the table. When you join an association, you're doing it to get something out of it. There's a traditional notion or concept of a culture of professions. And this was the idea that you choose this career path and then you follow a very specific path that's been laid out ahead of you and trudged by people before you, and you pay your dues, and eventually it pays off. And increasingly, there are other ways of approaching it. Yes, you still have to do all the hard work to get there. You have to complete the training, you have to do the residencies. That's all still there. But in terms of waiting your turn to make an impact, that doesn't apply to you. And that's a beautiful thing. And associations are a way to help you do that. So a professional society, a professional association like the AAAAI opens up career path exploration opportunities. Specifically, the AAAAI has the practice management workshop held every summer. About 200, maybe 150 to 200 people attend. There's fantastic networking, excellent educational sessions, but the focus is really on individual engagement, getting to know somebody. And the purpose for that is getting to know mentors and developing a network that will get you where you want to go, that will let you explore your individual interests for your career. The practice management workshop is one of those. We have other events and programs at our annual meeting. There's also, of course, as you already know, engagement with the FITS Assembly, and then also other follow-up and outreach and opportunities. The AAAAI is the sponsor of something called VAMPS, which is the Vaccines and Medications and Pregnancy Surveillance System. For the last couple of years, there's been a FIT chosen to do a research project with VAMPS. You get to decide what that research project is going to look like for yourself in conjunction with the team of principal investigators for VAMPS, and work on that till it's a published project that you get to own. That's all your work, and you get to design that yourself. There's also a seat at the table on the advocacy committee, specifically for a member of the FIT Assembly, where you're helping us work through the selection and the engagement on issues that impact you, impact your career, impact patient access to healthcare, physician payment, how payment works, and payer policy, a very broad range of issues. That seat at the table is really something to look at and something to consider. So that's my first of the 5 things. The second thing I found is that people at your stage of your development of your career are fearless. That sounded strange to me. I can't imagine being fearless and dealing with patients and having so much ahead of you and so much unclear. And I would be terrified if I were you. But you know what? I'm a lot older and I respect the heck out of anybody who's fearless. But even if you're not, I think that our associations, I think the AAAAI is a good place for people who may be looking at the world ahead of them, looking at the medical career ahead of them, and to whatever level you're embracing fear, or to whatever level it's scary, or it's just welcoming, or it's just super exciting. Again, the mentors that you can find through professional association like the AAAAI, and the engagement opportunities that you can make happen, special research projects with committees. We have a lot of committees within the AAAAI, and you're able to join those as a member. And special interests, whether it's a special research interest or a clinical practice opportunity, if it's a particular patient population, there's opportunities through the professional association to find other people to work with and make your mark as you're coming into your career. And there's speaking engagements, even when you're early on, through programs like this, or through our podcast, certainly at our annual meeting with posters and abstracts, to identify those things that you're deciding to own for yourself in your own career. Even from the very beginning, you can find ways to engage on those through professional societies. And again, I have to bring up advocacy. It's what I do. So, earlier today, one of my colleagues and I, we had phone calls with 2 different members, with offices of 2 different members of the Senate, talking about a penicillin allergy bill that the AAAAI is sponsoring. We have a lot of members who are engaged in that issue. They are working on getting the word out in their communities. They are working on really making a change in their patients' health outcomes by advocating for that at the local level, with us through a national organization, and a number of people who are doing so on social media. We can help you do those things. It's an investment in your career, and it's an investment in your community. And the AAAAI can help you do those things, whether you're actually fearless or not. So the third issue I wanted to bring up this one rings so true, because it fits everybody I know who is in roughly your age range, and all of the fits I have had the opportunity to work with. And that's that you care so much about the people that you're around, the people that you're in training with, the patients that you're seeing, and the patients that you will spend the rest of your career treating. Otherwise, you wouldn't be doing this, right? There's obviously much easier ways of making a living, but you're all in, and it's a beautiful thing. And along the way, though, it's not just about caring and working so hard, but there's other parts of it that you care about. You care about having a good time and having fun with it. You should get some enjoyment out of this, or it can't possibly be worth that much hard work if you don't get to enjoy it along the way. The activities and the work groups and the engagement opportunities are fun. You can have fun along the way. And the AAAAI meetings, if you haven't been yet, you should really go. Find some of your peers and make that happen. Again, the practice management workshop. Last summer, we were in Denver. This summer, we're in Nashville. As FITs, you get a significantly reduced rate to attend. And then you also get to copy the recording so you can follow up and soak up all of the material later. So you can pretty much have a good time when you're there, get to talk to the people around you, establish some connections, and also make the contacts and get the context of the material. But you can also have an opportunity to share the challenges, talk with other people who are in similar circumstances in terms of figuring out what you want in your career, what your practice setting is going to be. Are there different business models that people are working in that do or don't work, that they can answer your questions and help you figure out what the best fit might be for you, help you identify job opportunities, help you identify research opportunities. If you want to keep one foot into research while working in a full-time clinical practice, what works for you and how you can find it. And you can help shape opportunities through the Quad AI. Again, almost all of our committees are open to anybody who wants to join. And then you can work with the leadership to identify those opportunities that are of interest to you. I was reading about how creative Gen Z and the millennials are. And again, I feel bad about using stereotypes, but I wanted to make this about you instead of just about associations. But there are great opportunities to be creative in your career development through our professional associations. I already mentioned the VAMPS Fit research project every year. There are work group reports that get published in all 3 of our journals. And those happened because somebody decided to find a couple of other people and write up their research project with. Whether it started with a survey through the Quad AI, or whether it started through a series of, a conversation about patient reports that you all, had either an experience in common, or were seeing something play out differently, or you're responding to other science that's out there and figuring out how it does or doesn't fit in with clinical practice in your setting. Those work group reports, posters, and abstracts give you an opportunity to put out there where your interest is and do some career development while being creative, and a great opportunity to do so because you're still in your FIT program. There's also the Quad AI Impact, which is a quarterly newsletter. We're always looking to spotlight members of the Academy, what they're doing, how you're making a difference in your community, what you're working on in terms of your career, your research area. And there's certainly an interest in FITs for that work. Practice Champions. Practice Champions is a roughly quarterly feature in the Practice Matters newsletter, which comes out the first and third Thursday of every month. And Practice Matters focuses on the clinical practice of allergy, asthma, and immunology. We talk a lot about our advocacy work. It highlights issues, clinical interpretation from the journals, but there's also that Practice Champions. If there's somebody that you as a FIT have seen doing great work in their community, really impacting the people who are in training, or who otherwise has inspired you, you can nominate that person to be a Practice Champion. And that is helping recognize other people who are making a difference and being creative along the way. People don't forget you've nominated them for something like that. It's really meaningful. But again, the networking opportunities of professional associations, probably the biggest benefit. And there just aren't many other things that give you the networking opportunities that professional societies do. So the other big thing, then, the 5th thing, would be to look around and ask around. Of course, I think the Quad AI is the best professional society out there for allergy and immunology. I'm supposed to be biased, right? But you should look around. A number of different programs are going to make membership more accessible for you as a FIT. And of course, you're too busy to join all of them. But if it's inexpensive, and if it doesn't take a lot of time to look at their materials, to see if they happen to have a program near you, if it's one that you want to go to, if it's online, it's worth the investment of a little bit of time when access is more inexpensive. Of course, we're all doing that because we want you to be members, and then we want you to stay members throughout your career. But as a FIT is a really excellent time to look around. You can identify which organizations are working on the issues that are really of interest to you, where you see leaders who inspire you, or who you would like to talk to become a mentor, or even just to reach out and establish some level of connection. Our leaders are very open to hearing from people. They've been where you are, possibly with less challenges than you're facing, certainly without the social media tagging along on everything everyone's doing. But they do know how passionate you are. and they know how much you care, and they know how creative you are, and they know how bold you are. And they do want to work with you because you're the future of the specialty. You're the future of patient care. And so they'll welcome you. And the Quad AI will always welcome you. So again, it may sound counterintuitive that I'm encouraging you to look around, check out other organizations, both in the specialty and outside of the specialty. We want to keep you in allergy, don't get me wrong, but are there policy groups you're particularly interested in? Are you especially interested in working with a physicians group that's focused on environmental impact, on climate change, on patient access to care, on women's health issues, public health? Is healthcare in schools of particular interest to you? There's organizations working in all of those spaces. And the FIT period, although it's crazy busy, is a good time to look around because those organizations are all going to target discounts and possibly free opportunities to attend their meetings, engagement opportunities that it's good to take advantage of. But then come on back home to the Quad AI because we're always going to be here for you. And we love the Fit Assembly, and we always are open to hearing from you. A number of our committees, like I mentioned earlier, have a specific seat put aside for a fit so that we are hearing your perspectives and your concerns. And there's always a place for you in the Quad AI. And if at any point in time I can answer a question for you, you can always contact me at advocacy@AAAAI.org. Email me anytime. I'm not going to get back to you right away, but as soon as I can. And we would love to hear from you. So 5 things to know about professional associations focused on what I think you might want to know. It's your seat at the table. It's there for you anytime. The connections and opportunities that you get through professional societies very much matter, and we will enable those opportunities as a professional society. Number 3, it is all about you, what you're interested in, what you want to accomplish, what you want your practice to be. Number 4, it is an opportunity to make something happen. This is the time, even though it's a really hard time to imagine adding anything else on, your in-training opportunity is a great time to make something happen, to set you apart or explore your interest. And then 5, like I said, look around, check out your opportunities, and then come on back because we're always going to be happy to have you. Dr. Patel, that was a lot I threw at you very quickly. Do you have any questions for me?
I do not have any questions. That was wonderful. Thank you so much. Before signing off, I would like to thank again Sheila for volunteering her time. We appreciate the information and guidance you shared for the FITs. If you have any follow-up questions after viewing this session, please reach out to our FIT staff liaison, Mari, at mduran@quadai.org. See you soon.
Thank you.